requiring a vote from all the regions and sub-regions on whether we concur with the way they've been doing business. And sorry to tell you guys, Reading was the only one that did concur with the way they're doing business. And I didn't find out until after I had made up my mind, that I did talk to Kerry about it and stuff. But there's just a lot of disgruntled health officers that, you know, if they had put that same energy towards trying to work together, I mean, Region 3D, where I came from, they voted fully and quickly for it. They've had lots of vaccine over there, Salem State.
Right.
Played the hotel in Danvers. They're doing veterans posts between Gloucester and Beverly. And it's because everybody's, and Gene's sick of hearing me say this time and again, but it really pays off to have, you know, working relationships. And we'll get there, but when we haven't been there yet. And so I'm not blaming the state for not giving us some, because I think they're giving it to certain people.
Yeah, that I don't get.
Yeah, I do. They don't want to do it to 300. I've been saying this too. 351 cities and towns is just too broad. Come on, you guys, work together as 10 or 12 coalitions, and we'll help you out. And we didn't work as a coalition here. And
you know, the requirements that they laid down in that Sutter's letter.
Hey, Carrie.
Even if you work as a
Carrie.
coalition, even if you can dispense, hi Carrie, even if you could spend $750 a day throughout your region, it had to be in a region that had geographically was a needy region, which is why the you know, the collaboratives that are coming up are like in Western Massachusetts or on the Cape, or they're in regions that are not around mass vaccination sites. So I think that even if I agree with you that we need to have better relationships, but even if our region had pulled together and requested, I don't know if they would have granted it, because we're not in a region that, from the state's perspective, you know, is, you know, already has access through the sites. I don't know. Is that your?
well, I can respond to that. And my middle name is argumentative when I want it to be, but yeah, Lawrence is in our region. The same way Lynn is in Beverly, Salem, Swampscott, Danvers is.
Yep.
So you get one of those confounding factors, and all of a sudden you look across the board, and yeah, okay, this is a needy region, and they did that intentionally too.
No, yeah, I because there are going to be groupings that are going to be arguably have access to mass vaccination sites. That those standards are, as I understand, are being considered, but there are ways to work around them. Which is what I say is this is no way to run a railroad, but what do I know? I'm not running a railroad.
You walked into it's the tail end, Carrie, and we're talking about the last meeting you and I were at. And
yeah.
I mean,
what was the final decision?
Was it 6-2? One.
6-2.
Reading and Linfield were the only two that voted to stay.
Concur.
I voted to
concur. Yeah.
Concur. Thank you.
Yeah.
And
yeah,
Linfield had to retract. First, they didn't want to vote, so we would have been the only ones.
Yeah.
And stuff, but all right, enough.
It's been a very challenging discussion all around the state. Lots of discussion. So.
All right, well, why don't we call the meeting to order? And I'll just kind of review the agenda. We have the minutes from the last meeting. We have this spanking new Health Division report that we're going to review. And you can pull it out on your email. And then Kevin's going to update us on the coalition. advisory meeting. We'll go through the usual COVID updates. And there was one question about purchasing influenza vaccine for this fall. I wanted to have a little bit of discussion on, and then follow up for next meeting, agenda for next meeting. Are there any other items that we should review that anybody had? No. Okay. I just want to comment on a couple things. One is thank you, Carrie, for drafting that letter, and thank you for people who provided edits and suggestions. And it did go out last Thursday. I haven't received a call from the governor yet, but I'm not holding my breath.
He's
Waiting by the
busy.
phone on that one.
He's busy.
Yeah, he's busy, I know. But I do think that even though it's probably not going to change anything, maybe now in phase 2, you know, potentially in phase 3, if he hears enough about this, that, and there's more vaccine, that we'll have an opportunity to provide it. So we'll have to see.
Yep.
The other thing I just want to mention is, as you all have seen, is that our health agent, Laura Lessig, has resigned. And, you know, we wish her well. And Peter is in the process of trying to pull together some contract fee-for-service health agents part-time who can help do the inspections along with Dan, you know, to keep our work on track. I don't know, Peter, at this point, you don't have anybody lined up?
Let's see, Laura is on board effective until the end of the day on Monday.
Right.
So I think the best thing to do is just wait until Tuesday and let some cats out of some bags or whatever you want to call it.
Okay.
I've made some calls, but I haven't got any commitments or anything like that.
Okay. Moving on, unless there's discussion, Carrie?
I just have a question. So Laura, we voted, or some of our predecessors voted to appoint Laura our agent at some point. And do we need to rescind that vote once her resignation is effective?
I don't know. I guess that's is that a question for legal, Jean? I'm not sure.
I'll take a stab at that. So, effective Monday, I think there's at some, say the end of the day, end of the business day on Monday, she'll no longer be in any way an employee of the town, an agent of the town. Her status is at that point a prior employee.
Okay.
So I don't think you have to do anything.
Okay.
But I think that is the natural course.
Thanks. I meant to look out in my handbook and see if I could find anything. I just got tied up in things. So thanks for that opinion. Thanks.
Okay. Peter, you didn't get any emails for public comment, I presume?
Correct, I did not.
Minutes, everybody saw the minutes. Was so nicely done by Jackie. Any comments, edits, suggestions?
I didn't have any.
I didn't either.
None from me.
All good?
Yep.
Okay. Motion to approve the minutes from the February 18th meeting.
So
Second.
moved.
Second, roll call, Paula,
Yes.
Carrie,
Yes.
Rick, aye. So they're approved.
Nice job, Jackie, thank you.
Yes.
Yes.
Thank you, Jackie.
So efficient.
I know. It's just remarkable how easy it can be after digging
Yeah.
ourselves out of our hole last summer or fall.
Oh,
Seriously.
oh,
It's really
maybe
nice.
never have to go through that again.
Just
Bad
thinking about
bad
that.
dreams about minutes.
I know. That was
Nightmares.
something.
Nightmare.
Yeah.
Oh,
Mm,
that marathon meeting.
mhm. I know.
Okay, Health Division Staff Report. I don't know, Peter, how you want to do this. Do you want to walk through, or how do you want
Yeah,
to? Do
sure. If you don't mind, bring it up and I'll walk through it. I was just messing around with Kevin's. I sent you Kevin's a moment ago in case you got that. So Swung's here to hold my hand through some of this stuff because Christine has been out all week. So at least for the first couple of blocks, I'm going to wing through here. The case count that Rick received on Tuesday, maybe it was Tuesday morning, I think. That's what you're seeing today. And we're kind of cutting back, partially because Christine's not here, partially because I'm relieved that we can do it less frequently than on a daily basis. All right, so that comes up. Here we go. And so the cases you see here are what should be posted on our website. This one was done the following day. Oh, this was on Monday. That's when we deliver the message to Jane Wellman, who posts it on the website. For Rick's purposes, when he meets with Select Board, which, by the way, did you meet with those guys on Tuesday? They went into an executive session. Right.
So Carrie, you're glad you're not doing this anymore. The agenda item was for 8 o'clock for COVID update after a 1-hour executive session. By 9:45, they still had not come on. They were still in executive session.
Wow.
At which point I told Caitlin that I had to get off, and I updated them by email the next day. But it was a 2-hour and 45-minute executive session.
Wow.
Yeah.
Yeah.
Whew. Anybody know
They
how
did-
late the actual meeting went afterwards?
You know, I think it actually, they must have compressed it because I read on the Reading Post it ended at 11.
Okay.
And so it started at 7. So
Yeah.
But we had
Wow.
Mass DOT, the Department of Transportation. We had like, I don't know, 7 people from the state,
oh my God.
and myself and 3 or 4 other staff people in the waiting room too. And we didn't want to leave because we thought, oh, well,
Yeah.
It's always, you always think it's just gonna go on. So it could just have, they'll just appear, but it just kept going and going.
Wow. Gee, I'm sorry I missed that, Rick. Thank you for that service.
Sorry about that, but back here, the top section is what Jane gets on Mondays, and every other week, you can see that this happened on Tuesday at around almost noontime. And they changed so slightly the cases, that is. So, that's the difference between Monday and Tuesday, and between Tuesday and Thursday. I didn't feel as though we needed to get that particular info. I'll collect the feedback and try to bunt them back to you as gently as possible. But, we're doing a good job on this website now. We have the histograms that are showing, the drops and peaks, valleys, and so forth. I think the Globe and the popular press is covering it pretty well, and nationally it's starting to subside. There was a doctor at Brigham and Women's who was a research person, and he's got some, and I didn't read it, so I can't. And I think I brought this up the last time. It sounds like I'm deja vu here, but why the virus might be waning at this point. So we'll just have to see whether or not these data are enough for you. I'll take it and pass it along. Christine will be back, and she'll do whatever we ask her to. I'd like it to be reasonable requests, And I don't think 2 days worth of data is unreasonable, but you say. So that's all I have for EPI 1. I can report later about some Maven stuff, but I'll give you a little brief period here in case you want to comment on the first part and my, insistence that we don't need data every 2 days.
Yeah, I think weekly reports of case counts is more than adequate. And I think that in terms of some descriptors, like as listed here, clusters, closed businesses, school, athletic, I think as appropriate, if there are things to talk about,
Yes,
list it there. It isn't mandatory. It's just certainly it was a bigger issue a couple months ago, and hopefully it'll keep improving. For the Maven data, it would be nice to. I have seen in one. I don't know where I saw this in some report where there's this long, lengthy list of communicable conditions, and it lists how many have been reported in the town. And most of them are 0, and occasionally there's a 1 or 2, or a hepatitis here and there, or whatever.
okay.
So I think in the Maven section, it would be good, not to see that
Yes.
whole long list, but to see whatever few cases might have been reported in the town.
You've stated that before, and I don't know what happened, but if Jackie can make note of that, I'll try to remember for next time. Yeah, there is a list of reportable diseases that goes on and on. It includes, Zika and
We don't need to see
West
all
Nile
this.
virus. Yeah.
Yeah.
We'll try to attach some of those too. We can do that. I'll blame Christine for not being here for that omission. Let's see, the other Maven data though, and this is where I was going to fill in some of the blanks with just some rhetoric more than anything else, but actually this is important news to me because last week I just laid it on Huang and she was able to pull it together as far as getting the report for public safety. And I've been saying there is a way to get it other than the way we were getting. And I didn't know how to do it. I've been off Maven for a year or so. And or more actually. I wasn't using it before I left even. I had competent help. And so I didn't need to go onto Maven. But Shuang figured it out, and now she knows how to make a report for the public safety, and she has agreed to do that a couple of times per week. And Shuang, if you want to say anything as a lead into your next part, which is going to be the vaccination program, as far as getting those reports to public safety, what do you think of that?
Yeah, so I for the total confirmed cases, I just run a report this afternoon, and so right now we have actually 32 new cases from February 26th. So this is just an update. And for the public safety report, this is basically a report we give to fire department and police departments with the active case address. So we can do that a couple of times a week. So we will discuss it with the, I will discuss it with fire department and police department.
Okay, but the point is that it can be done easily on Maven, correct?
Yes,
Okay.
and I'm able to get this report.
Yes. So Shuang, whether she likes it or knows it or not, she's evolving into local health. Not every week her job changes, but it is expanding and slowly but surely expanding now. She did the prep mod piece and the MIIS, and now she's getting her feet wet in Maven, and we're glad that it's all going swell. She's not complaining.
Thank you, Shuang.
Yes,
You're
thank you.
welcome.
So want to keep it going into the vaccination program, and this is not about influenza. We'll do that later.
Sure. So you want me go for the COVID vaccine first?
Yes, correct. I'm sorry. Yeah.
Okay, and I'm gonna share my screen. So do you mind stop sharing your screen first?
Is that Rick? Yeah.
Okay. So COVID-19 vaccinations in Reading. So first, I'm gonna talk about some numbers. This is the number of people in Reading already got vaccinated, including first dose and second dose. So till early this week, first dose
Sorry,
vaccination.
folks.
You have any question? Oh, okay, sorry. So till early this week, our first dose vaccinations are 281, including 163 in phase 1 and 118 in phase 2. And meanwhile, 95 out of 163 recipients received their second dose. And here is the vaccine we received and the order. So the number of vaccine we received after January 28th, 2021 appears here. So on January 28th, we received 160 doses. February 22nd, we received 100, and February 23, which was last week, we received 100 doses of Moderna vaccine. Yeah, they are all Moderna vaccines. And next is the number of vaccine. The number of Moderna vaccine we have right now is 100 doses. We ordered 300 doses Moderna vaccine this Tuesday, but we are not sure if the state will deliver them. And so far we haven't ordered any Pfizer vaccines. And next is the vaccine clinics. So starting from January, we already had 8 vaccine clinics in Reading. And tomorrow, March 5th, we will have 2 vaccine clinics in Pleasant Street Center. The first one is for 66 people, second dose. And the second one is for 21 Reading residents, first dose. And we will also do a 10 dose home delivery tomorrow. And starting from February 5th, we use PerpMod to manage our clinics. Here is the workflow. We use PerpMod Manager Inventory, create vaccine clinics so the participants can make their online appointments. And we use PerpMod Manage the clinic. And last, we submit the data to MIS. And the last thing is the current COVID-19 vaccination phase 1 and phase 2 eligibility status in Massachusetts. So, so far, all phase 1 group 1, all phase 1 groups and the phase 2 groups, group 1 and 2, they are eligible to get vaccine. And starting from March 11, all teachers are eligible for COVID-19 vaccine appointments. So before I move to flu shot, do you have any questions regarding our COVID vaccine and clinics?
I have, oh, go ahead, Paula.
So I'm gathering from what you're saying is that there is not enough vaccine delivered to give all the phase 1 people their second doses at this point?
All phase 1 people, so tomorrow we will have the last group of phase 1. They are 66, they will get their second dose. And so after tomorrow, we shall finish the all phase 1 second dose.
The state is committed to providing all the second doses needed repeatedly, and you've got it. You have the vaccine, right, Chuang?
Yeah, we ordered the vaccine, both first dose and second dose from the state, but we are not sure if the state will deliver them.
Second dose, they will.
Okay.
Well, hang on, that's not true. The 100 doses that we'll be administering tomorrow, 66 of which are going to second doses, are coming from an order that was for first dose vaccine. We had also ordered second dose vaccine and we never got it. So we're using the first dose vaccine to cover us for the second doses. And, I'm not going to get hung up on, poo-pooing anybody or anything, because it's always, after the fact, you look and say, what could we have done better? It's easy to try to blame something, especially a moving target. But one thing I will say is that Schwung is now making inroads with human beings who answer the telephone where the vaccine is coming from. We had been filling out forms and sending them in. Gosh, you wait hours to get a temporary password. I waited hours to get back on the MIIS after I had let it elapse and everything. And then I realized, I got to get back in here to try to help some way. And it's just impossible to get a voice of somebody that knows what they're talking about, especially once you do get the voice. It's not that comforting either. But Schwung has found some people who she can call. And I think that is like a major inroad. And this is what I was saying earlier about, having opportunities to work together and having, I don't want to call them connections, but resources at the state level where they're convinced that you're doing things. It isn't just a minor effort, it's a major effort in trying to get these vaccines. And the state, I don't think, is bought into the fact that anyone around here, and I know I'm being a little bit harsh at this point, but we can't get vaccine, and it's the other people that are getting it. And the only reason I can come up with is they want to have some level of comfort that someone is in charge of them. And with Schwung now getting used to talking to certain people, I think they're starting to get that. And I'll take responsibility. I'm miles away. I've tried. I don't think I tried hard enough, or whatever it takes. You got to be full-time into it and working with your people, working with your colleagues all the time to get stuff going and working together. And that's just not happening, but it will. So right now we're making headway. Maybe starting next week, we'll start seeing these second doses that we promised. Go ahead, Kerry.
To clarify, on every state call that I attend, and I attend them all every Tuesday, every Friday, they say we will be providing second doses. We commit to providing second doses. So they are committing to something to the people that you're telling me that isn't happening. And that's important to know. So I just want to be clear about that. That's what they're saying, and I'm going to raise it, is confusing. So thank you. I didn't know that.
Well, we heard, and I'll share this with you just so you can be accurate with whatever you do and how you deliver it. But when we asked closely, and now we're talking to a human, this is Schwung, and they said, we never got that. Okay. And I said, wait a second. Schwung, generate the written report that you sent in, please, because we have a paper trail. Right. And she was able to do that.
Right.
And then and if I have it wrong, Schwung, say so. But then they would say, oh, we did receive that, but we didn't process it up. Something to that effect. So there's things that fall through the cracks.
Sure.
And you expect that sometimes.
Sure.
But I don't think I could name names in other places where it's not falling through the cracks because they are firm but courteous. And this is something I'm pounding into Schwung right now. You have to be firm but courteous. But firm. McCurdy. If you don't, they bypass.
So, but as of now, we
Yeah.
haven't had a deficit in vaccines for second doses. I mean, so far, I mean, sounds like there's kind of a concern and a possibility or a threat, but so far the state has provided the second doses on time. Is that
Well,
right?
it's a matter of, it could be a matter of semantics at this
Right.
point. In my opinion, we ordered first doses, 100 of them, and we had to use innovative measures. And using the doses that we were given that were earmarked for first doses, we had to use them for a second dose. And that's wrong. So I would say that's your statement, Rick, is not entirely accurate. Yes, we've gotten by because of our innovative measures, not because of them giving us what we've been ordering. And that's all I like to say, because you start to sound bitter
Okay.
after a while. And I'm trying to be firm but true.
I have one comment and one question. One, well, the question is, I saw in some material today that the state is launching a program to vaccinate homebound individuals. That there's going to be either the option for local boards to vaccinate them, or there will be a state option, and that you actually have to by next week, I think, or commit to, you know, are you going to do it or are they going to do it? And so I guess the question I have is whether, I know we had done some homebound vaccinations in February, and really there was only a very few people who were actually homebound. Where are we? Do we feel like we got that covered and there are no more homebound patients that we have to worry about, or should we be doing something around the state program?
10 more tomorrow that we've identified through the senior center. After that, someone's going to have to shake the bushes to find the homebound. I've offered ideas through the Meals on Wheels thingy, which is, for some reason, doesn't work around here. But yeah, after we do 10 more tomorrow, Rick, I think we might have them all. I mean, you never know.
Yeah.
I'll just say we're a little ahead, frankly, because the state on the call on Tuesday was, okay, we're going to do this, and I haven't, the slides have not come forward, so I haven't shared them because I don't want to just say this is what I heard. I want to provide the backup data, and they have not yet been approved. So I can't share them, but they have said homebound program, very strict requirements, only certain people meeting very specific criteria. You can't be this, you can't be that. So we're kind of ahead of the ball, and I'm fine with us. I think it's great that we're able to vaccinate folks who are homebound and unable to get there. But we're a little ahead.
Full credit to that. For that goes to the fire station. I actually pushed back and said we shouldn't be doing them because of what I felt were, you know, protocols on hygienic and sanitation and stuff like that. But
Yep.
the fire department, ultimately, at the end of the day, you got twang getting the stuff and putting the clinics together through PrepMod, but you really have the driving force is fire services. And I don't know when they're going to get tired of waiting and hurry up and wait, but they will go down as the heroes in my book as far as getting whatever's been out there out there.
I also want to pass on something that Jean mentioned to me, and I don't know if it's been discussed in Incident Command around the other high priority group in the first part of phase 2 is the people in senior housing and low-income housing. And I understand that Greg Burns has been coordinating with them because they need to actually identify a provider who's going to provide vaccine, and whether it's a pharmacy or someone else or us, and work with that provider to set up a clinic at the site of the housing to be able to vaccinate those people. And so I'm presuming that's taken care of and that's underway.
I got a
Yes.
quick story about that. And it, again, is the fire department. I pushed back with Greg, didn't want to give out the PIN number. Told by my other colleagues in this region, don't give out that PIN number, you'll be responsible for it. And I stuck to it for a while. Greg had, what do you want to call it, showed me the light. And we put in the order last week. I was with Schwung when we did it. And I would say 10 minutes. And if I'm exaggerating, Schwung, just speak right up. After she submitted the order, we received notification from the state that they received the order. You haven't received the order, but they received our request.
Yep.
And so it seems like they're very, interested in doing this. At least it's the first time I've seen them, do something in a tidy manner.
It's a separate supply. It's
I know, but still.
specifically separate supply managed separately with EO, with Executive Office of Elder Affairs, EOEO, managing. So they have fewer numbers to cope with, and they are right on top of this. Yeah.
A live person at the other end received our request and responded to it. They've
Yep.
never done that yet.
Yep.
And so we think we found a little tickler there. And again, Greg Burns, who should be a health officer someday.
Yep.
So we could move on to environmental.
Yes, thank you. I think that's the end of the vaccination programs from Schwung's end. So here we are. It's pretty. What's
Sorry.
up?
Do you want to talk about the flu vaccine?
Influenza will come up in just a few minutes. Okay,
Oh,
can you
sure,
stay?
sorry.
Can you stay on?
Of course.
Okay, yeah. Thank you, then. Hang tight. We'll move through this more quickly. All this stuff is basically self-explanatory. And I'm looking here at the food programs. There's the number of, okay, on this left column where my cursor is right now, we sent out 165 in 2020. We received 45 back in 2020. And so whatever is back here, so that brings us down to, let's see, about 125, I think, or 115. And we've received 93 of that 115 in already now. The other, I guess it's 22 other schools, which haven't been operating right. I don't know how many schools are in Reading right now, but we usually get a separate permit from each of those. And there could be some temporary ones or just a seasonal one. So I'm secure that we're doing well getting our permit. And that was a big deal up until now for me. So you have an explanation. You have any questions? If no, you can see after February, we've had 12% done. John's doing this many. Dan is doing half as many. He's got other things going on besides the inspections of food establishments. And we've only needed to do 2 re-inspections to date. In other words, we find violations when they're doing food establishment inspections and they make the corrections while we're still there. It could be the hand sink is being used to hold pots and pans, which is a no-no. Believe it or not, that's a critical violation. And the only way you can, it's a simple correction. Make it accessible for people who want to wash their hands with you. And they'll take the pots and pans or whatever they were using there to store their things in there. And you have to keep reinforcing some of these basic things because in a food establishment, in the restaurant business, it gets busy and they do what they have to do to get the meals out. And we don't have to go into that. So let's see. That was, there was one piece that we had to go back a third time, but he put down here as a note and I went over with him. The pot didn't arrive in time. So that's the only thing. And Dan's doing pretty good. I got to give him credit for, he's a little bit, he's a little slow, but he's deliberate. And that's okay with me.
Okay.
And, he's not unreasonable. He's courteous. And he just goes back and makes sure everything is the way it's supposed to be. And I don't have a problem with that in a health.
Good. That's good to hear.
I know, we'll see what happens next, but right now it's okay.
Good.
So from there, I think we can move up to the other environmental domains, and these have to do with the complaints. And we haven't had any animal complaints yet. Drinking water, you can go right down the list instead of just listening to me. We've had a housing complaint, one per month. One, and I could tell you the name of that one right off the top of my head, but I won't bother. Now we're gonna start seeing pests as the spring approaches, and that's, in my experience, you know, the big thing. People don't like to see rats run around their property in their neighborhoods, and they'll call the Board of Health on that. And there's not always an answer either, except that little thing that's sitting in front of Jackie, where his cat, no, his rat. I don't know if that's true either, but
Mhm.
solid waste is trash. And then these other ones, we've got 4 and 6. These are complaints. COVID in nature. I said, I don't want to keep the COVID in nature complaints. A bunch of people calling in and yelling, where's my second dose? This is not about that. This is about food establishments and retail food outlets that people go to when it's jam-packed. So they come out and call the Board of Health. We went to this place and shop, and there were way more people than are supposed to be in. So we'll follow up and we'll issue them some sort of a verbal. And, you know, Laura was doing this right up until the day she left. And I think there's people that will agree with me and there's people that won't agree with me, but these folks need to be getting the message routinely about how they, you know, need to be watching all the guidelines that are put in place for safety. And sure enough, those are the two big ones. Now that is the big one. 6 year to date, 4 in 1 month. So people are out there, they're noticing and they're calling us. I think that's a good thing to do. Let's see, the emergency preparedness, I'd ask Kerry to think about some things. Yeah, and I mentioned already, the big thing is the cut back on the number of times emergency services is going to get the update, and I think it's slowly kind of blending in. We're not ignoring them. We're not doing anything that would in any way jeopardize first responders or the public. I think it was overkill before, and it almost was crossing lines on how are we getting our data. Rumor by way of what? Now we're getting it from the one single source, and that's important.
Yes.
I'm seeing that people here nodding, Kerry, Paula, they do this stuff. You want to add anything now, Kerry, about our?
I just, so the vote today, the meeting today, Peter was, had mentioned, the new deliverables are part of that. So we know what those will be starting for July 1. And that includes an after action report for COVID response, which I'm very excited about. And, you know, I don't recall the numbers on the allocation, but, you know, if there's a little bit of money to put toward developing one, I think that'll be very important. After action reports are useful and valuable. You can build out nice, improvement plans based on them, and you get a lot of information. You know, certainly this board and the incident command group have done an extraordinary amount of work in the last year. So I was really happy that DPH included the after action report as a key deliverable. So that'll be something. So again, starting in June. And I had a question about it. There are regular WebEOC drills, and I don't know who is the WebEOC person.
That's a pretty good question. I think Schwung stuck it out to the end of the meeting. Did you bring that up afterwards? Schwung with WebEOC. Checking our notes.
Yeah.
Web VOC, you mean like?
I don't know the answer to that, Kerry,
Okay,
but we're
so
gonna
we'll
have to
follow up.
find it out.
Yep,
Yeah,
we'll follow up.
we will.
Sorry.
Thank you.
No, yeah, no problem.
Thank you.
Anything else about emergency preparedness? If you have questions, I'll try to, nail it down for you. And then I'm gonna need a minute on this community health prevention and promotion. Just slow down my cadence here in case you want to ask a question about preparedness. And Jean was with me today when we visited with, by Zoom, that is with the Metropolitan Area Planning Council, the MAPC. I asked for a meeting because I was sitting right at my computer on March 1st, knowing that the grant application was going to be released. Sure enough, it didn't happen until the end of the day, but I was still there. And I sent it right off to MAPC to see if they wanted to collaborate with us immediately, because this one is surrounding shared services. And, I'll just reiterate some of the thoughts I had from earlier today, and I feel bad for Jean. She's got to not only listen to my nauseating voice, but hear me regurgitate all my thoughts over and over again. And there is at least one community adjacent to Reading that does not have a health officer, that their police chief is the acting health director and is running the vaccine. They're dead in the water. We're not dead in the water, but we're pretty bare bones, if you will. And I think there's an excellent opportunity to do some regional planning around shared services right now. And so this grant is a 3-year opportunity for us to get some funds, begin something like this. And really the timing couldn't be better. When these things come out in years past, it's always about, if we do this, then someone is going to lose a job. They might not need 2 health directors in 2 towns. But right now, there's not one health director in 2 towns. So I wanted the board to wink, nod, something around us to keep us motivated on pursuing this a little bit. It's a very quick turnaround time. You have a month to get it in. We have MAPC kind of scratching their head and saying, it's an awful lot of, maneuvering to get 2 communities on board. Jean was really swell because she's been through it before, and over the course of years, she's gotten some regional services together. She knows it doesn't happen overnight. She has seen the nuts and bolts from close up. I think we got something going here. If we can get maybe at the town manager's level, and Bob hasn't heard any of this, and neither have the guys in Linfield. So what does my board think here on March 4th?
May I ask a clarifying question?
Try to answer, yeah.
Is this the Office of Local and Regional Health Shared
Yes.
Services? Okay. Yeah, the goal of those was to make the application barriers quite low, to make it easy for folks to be doing it. So I'm a little surprised to see. I haven't reviewed the notice of intent on it, but I've been in discussions about it, and that was the intent, was to make it simple, to make it easy for folks to come up with creative ideas of how to do shared services. So hopefully, a keener review will reveal that it's not so tricky. I don't
think it's that tricky, but I think we have to move quickly. And
Yep.
it usually is when you have, I'm sorry, Carrie, but you hit a nerve there. The tricky part is getting 2 administrators at the top of the pyramid to agree to let's sign on together.
Understood. Not talking about the people, talking about the paper. I misunderstood you. I thought I was hearing that MAPC was saying that that the application was challenging. So I think I misread. Okay. I think shared services is a fabulous idea. I think it would be wonderful for the town to be pursuing opportunities. If that is something they can find dance partners to do it with, I think that would be great.
Yeah, we've done it before.
Not successfully, from what I understand.
No, is that true?
Yeah. But that doesn't mean you don't wanna consider. So,
Are there any cons to something like this? I think the pros are fairly obvious.
Yeah, you know, and MEPC brought these up, but I don't know if they're applicable or not. Usually municipalities will look at opportunities like this to save money. So
Mhm.
why should we have an inspector for each town? We can have one inspector to do both towns, something like that. So that could be the con. You could get a purist in public health, and I feel as though that I am one, especially in the environmental side of things, that would say, you know, you're weakening the infrastructure of health when you go ahead and contractually arrange for your inspections to be done. You know, there's a lot of downtime if you have an inspector in-house and goes out and does a couple of inspections, comes back, answers a couple calls, it takes management. I don't have a problem with using contracted help to do that. Somebody else, Kevin, might be able to say that's not the best way to do public health. I mean, for the routine stuff that really needs to be done, you need a professional going in there, professional sanitarian or food safety specialist, to go in and point out where there could be weaknesses, and then
Sure.
let the folks back at the office do the follow-up. And, you know, God forbid there's enforcement or something like that, or additional training, determine which kind of programs you put on. I really don't see a downside.
Okay.
I mean, I would say conceptually, you know, it makes sense. You know, it's hard to, I mean, so directionally, yeah, we should be pursuing this, but I don't, the question is, what do we want in terms of the outcomes? I don't think this should be an effort to pare down resources
Right.
in both health departments because now we're doing it together and we could spread it. I mean, we have spent a year at least, or probably more, you know, trying to convince people that we need enough resources.
Yep.
And so what I would hope a proposal would show would be that with the existing or planned budgeted resources of both towns, that if we did something together, the outcomes in terms of public health could be much better than either one of us could do alone. And so that's sort of where you have to, you know, that's I think the goal. And so whatever the grant proposal you come up with, I don't think anybody could possibly, you know, disagree with that.
Right.
So that would be my perspective on it.
Yep.
I agree 100%. Well stated.
So we're sort of jumping a little bit over but I want to just, while we're on this top, well, we can bring it up later. Should we, can we move on from the report?
Yes.
Peter, so it was great to see the report, you know, partially populated, and hopefully every month when we see it, it'll be even more populated with, you know, the other pieces. Kevin.
Yeah.
Any
So I sent you all off an email. It's basically the packet that from the meeting, at the last advisory meeting. So just to touch on a couple of them. You can read through the rest on your own. There's some really good information in there. There's a lot of good information in there, specifically around school-age kids and programs that they have up and running right now, and making sure that, you know, from a mental health standpoint, that sector is being checked in on. So you can read through that. But there's a couple of things I wanted to mention. On February 1st, they reopened the Reading Police Department prescription drop box. So they have a box that if you have extra prescription medicine that you can go down to the police station, you can drop it in that box and they dispose of it properly from there. They've had, I know from the past, they've had a tremendous amount of cooperation from folks with that program. They also have it right now set up as well. If you didn't want to go down there, they can send you a a box in the mail that you can drop it in, and you can mail that into them. So that is up and running again, and people are able to go into the police station and drop it off if they wanted to. For the longest time, as you all know, we had that shut off from the public going into the police station. So that's reopened. Last year, they had some statistics that they shared with us. They reached 3,130 individuals last year through both in-person and virtual meetings, of which 240 of those was through the CIT follow-up. So that's the new program that they just brought on board last year. I brought up the last meeting as well too. That's the where they're flagging some calls that are coming into the police department, and they're working with these folks to get them over in front of the Sammy and Erica to help get them extra services. So they had last year. They had on their initial startup, they had 240 of those calls worked their way over, which is really good. It's a great start for them. Some good news for the advisory committee. Their budget is up, much like ours, which is good. Is up 23.4%, which is going to allow them to do a whole lot more outreach. So I think, that in a time that they're really going to need some extra resources. The residents are really going to need some extra resources out there. This is really good because this is going to help them, probably best that 3,000 number that they got reached out to last year. So that will be a big contributing help. Again, like I said, I sent you off the packet that details a whole lot of other things. They're not necessarily intertwined with us, so I figured I would just leave those to your individual reads. But if anybody has any questions about what's going on with any of their programs, I can certainly answer them.
Thanks, Kevin.
Thank you. That's very
Welcome.
helpful.
Sorry.
Carrie?
If I could, yeah, just, Kevin, it's in the report, and because I was complying with open meeting, I did not check in with you or update you, but after our meeting 2 weeks ago, when I was asking the question about sort of community-wide macro interventions, I thought, oh, I'd better follow up with Erica myself, because I kind of.
That's right. Yes, we did go over that. Yep.
Yeah, and I did have a call with Erica and Sammy, which was very productive, and so she mentions it. It's mentioned in the report that they'd like to plan an event to sort of talk about some of the things that this community has done to support each other and come together since and during this pandemic.
Yep.
And the reason that I was pursuing that is that in emergency preparedness, you have preparedness, response, recovery, mitigation. And the recovery, people often kind of skip right over recovery. They're like, yep, event's over, boom, move on to the next thing.
Sure.
But a key component of recovery is community resilience. And that was the tie-in with the substance use folks. That's something that they're working on an individual level all the time. And knowing Erica as I did, that was why I pursued it. So they were really interested. They're very willing partners. They're great folks.
And to expand on that, we did discuss that. They brought it up during the meeting, and there was a lot of ideas that were thrown out during that meeting, and I think even some follow-ups after the Sammy and Erica. So they have plenty of ideas, really, I think, from that meeting and afterwards to really put something together on and discuss it. And it is pretty amazing when you think about, right now we're in the weeds with everything that is coming at us at light speed, right? Yep. And it's tough to look back. I think I've been saying this for about a year now, literally.
Yes, you have.
The look back will be the most interesting part of all of this.
Yeah.
I just didn't think we'd still be here a year and not looking back yet. So, but it's what it is.
Yeah. Yeah. So I think that's good stuff that they will be doing, and I'm glad.
Yeah, and I'll most likely have an update for first of the month next meeting for our meeting. Because I think that's going to be on their topic again coming up the end of the month.
Great.
Great. Good. So next on the agenda was COVID updates, which we've kind of mostly covered. With respect to the work that Paula was doing with Laura, obviously that's a little bit dead in the water right now. I don't know if Peter, if you've given any thought about how to continue that, or whether that has to be put on pause, or how.
Put on pause. I mean, we might be able to get, I'm not sure. I mean, I can come up with brainstorm ideas from Eagle Scout projects to, senior class projects or something like that, just to get out and get posters, around, but I'm not sure if that's a good idea yet. And I just assume let it, I mean, it's not a high priority right now. We have other things. Go to the line item right above it about civic and recreational permit issue. And, we're gonna start seeing an influx of those things. I got here and it was like November, the beginning of November, everything was dying off. And I was warned kind of through different means that, this is a big thing, this is important to the board. And when I took it over, I was not taking it seriously. It's gotten enough redundancy, so I started to know the players, but now we're getting all new players. And graduating classes coming forth, they want to do things that are going to be tough. How are we going to pull it off? And they're coming right out in their little addendum. We know this is more than what the state is allowing, but we're asking you, wait, I don't think that's going to work. And so if we add resources, it's not going to the COVID guidelines for compliance and food establishment. Gene and I met this morning with some folks in town hall, and I'm still very impressed with this community. I can't get over how much everybody wants to pull, and the burnout in town hall doesn't seem to exist. It's like they're psyched to help as much as possible. At least that's the impression I'm getting. And so they're going to need some help with that stuff coming up soon. I'll be in touch with you as that goes along. Hopefully, it won't get to the point where they're coming into the board, but we might want to put together some sort of I don't know if it's going to be a subcommittee. I don't see how we could. Really, we'd have to start to work on it. Can you just give me some direction? I can do it unilaterally, but I prefer not to. I mean, just to say no or okay is not always easy. Not everything in this business, black and white. So that's how the guidance compliance fits in with the issue above it when it comes to civic and recreational permits.
Yeah, I mean, to continue with the effort that Laura and Paula were engaged in, I mean, the materials need to be revised. The standards have all been changed.
They changed, that's right.
We've moved to a new phase. So the information is outdated. And yeah, I mean, maybe at this point, given the circumstances you're describing, Peter, it needs to be left to enforcement. They don't lack for information on the changes in standards. And you've made a very compelling case that there are lots of other things happening in the department. I don't know what others think. Or
could I add one thing while we're hot on this topic? That if the public is listening, and you saw earlier that we do respond to complaints.
Yep.
And is this a catch as catch can issue? I would say a little more than that. But if there are people observing, they have a place to contact and inform, and we will follow up. Maybe that's the best way to take it.
I think also if we're doing routine food establishment inspections, this could easily be part of it,
Agreed.
And
Yep.
so it's not as, as much as maybe we had hoped, but it could continue to keep the eye on the ball there.
Yeah, agreed.
Okay.
I
Go ahead.
don't know where we are. Are we on
Influenza.
incident command updates?
Yeah, let's do incident command updates. The only other item on that.
I thought that was handled up above, but if you got something, Carrie, go for it.
Well, we talked about the testing program that the schools are implementing.
Oh,
They're schools are, they've begun. Last week was athletes and staff. This week they incorporated high needs students. Next week will be everyone. think there was one positive pool, whatever. They've got about a 40% uptake. They're happy with how it's going. They get good support from CIC Health. So it's all, or decent support from CIC Health, I guess. So that was a source of the discussion. And then the other discussion was just in anticipation of the move towards opening schools. The school department did kind of have some general conversation with us of what are the considerations here? What does this do for impact? You know, there were no decisions made. It was a based on what we're hearing now, based on what the governor and the education secretary have announced, we're considering how do we go about implementing these things. There was a question about whether the board was interested in their house. I said that for myself, I would be very interested in knowing how they are going about generally implementing the 6 foot, 3 foot, navigating that particularly, because that's a key area of concern. And I was not interested in knowing how it works in every hall, but I wanted to know what their, so it didn't need to be that specific, but wanted to, thought that was important to understand. If there are other things that folks are specifically interested in for the school reopening discussion, you should please let me know or let them know, and I'm happy to carry that on.
Yes, Carrie, thank you for doing that. And I just would tail off this with the discussion that came from the schools and beyond, because they do rentals and there's recreation leagues out there too. And I heard from Jen Fiorente just this morning, and they're expecting an influx too, that people want to get out and start playing pickleball, and they want to rent the gyms for the weekend. How long is it going to take to clean before? And then it ultimately came up to, so what can the Board of Health do to make our lives easier? And I made the suggestion that if we could keep the permit piece in place with the addendum, we'll do the best we can to keep up with the the workload there. And that kind of ties in two bullets above this, or below, or wherever we are in all with what Kerry said. Thanks for the tickle, Kerry.
Yeah, because they're concerned about their ability to host the activities given the kind of different uses that they're having for the gyms, for example. And yes, and then we flowed into the recreational activities, and I have volunteered to assist, at least initially. I can do some review. Flag football is in my inbox.
I bet.
Yep. That I'm told is just the beginning. They're, Jenna recreation wants to get their catalog out. And we know that as soon as anything gets reviewed, they're going to issue new guidance. But so I'm trying to review based on what there is. But yeah, I mean, it's a busy. I would review them, pass them back to Peter. But as you will remember, it's busy. Well, Rick, you weren't, or were you there for all of that?
I wasn't there for most of it. I remember you and Paula did a lot of reviews at the time.
Yep.
Yeah, it's busy.
I think Carrie did the most.
Well, because we had like baseball,
right,
chomping at the bit, ready to play. And we didn't have guidance and a lot of all those different sport activities. So yes, so that, I mean, it's going to start to get busy. And I'll review just as a support to Peter and then kick it back. I'm sure
I'm happy to do that too.
Who might volunteer to do that too.
Carrie, you've got plenty on your plate. I'm happy to do that.
So yeah. We'll help you out, Peter. We know how to do this. We know what to look for.
I enjoyed retirement for a couple of months there. We came back to part-time and it's getting busier all the time. Okay.
Right.
So that's it.
Good.
That was all.
Something to look forward to.
Well, at least it's a movement towards normalcy.
That's true. That is
Yes,
Yeah.
yep.
I noticed on one of the new guidelines, in terms of singing in schools, there's now 10 feet. So
Yep.
we had the 3 feet, we had the 6 feet, now we have the 10 feet.
Yep.
Just keeps moving along.
Yeah.
10 feet masked, low volume. You're supposed to sing softly. It's hard.
Influenza vaccine.
Ah, this is looking ahead.
Yes.
And here's a little bit of background. I'm going to turn it over to Swan in a moment. And she's going to give us a report, some stuff that we will be elated to hear. But on Monday at our pre-board of health meeting with Chair, I was pretty firmly planted in boards of health are not doing vaccines. Can't do it now during this most important time. When it comes to influenza season, there's other places to go to get your vaccine. And in Danvers, we never purchased influenza vaccine. If the state gave us vaccine, we would distribute it. We didn't like the idea of spending our own money and getting a portion of it back and keeping a revolving fund, which Gene can tell us. And I was impressed with the amount of money. Since then, Rick, and I would have made it clear that I'm not going to call back the Don sales rep, but Rick is wise and I'm not that wise, except I do listen to people sometimes. And I listened to him as we embarked on a different route altogether. And I did call back our sales rep and then asked Juan to look into a little bit. And then I'm going to ask the board for the support, which I bet is going to just be like falling off a log, that we continue doing influenza vaccine in clinics in the fall, despite the unhappiness that the COVID vaccine is causing us. I think we can suck it up and do influenza. So let me turn it over to Schwan so we can stay on pace and get it all taken care of. And Schwan, you're going to bring up a shared screen now?
Yeah, I'm gonna screen here. Okay, so I'm gonna play it. So yeah, besides COVID vaccine, I'm gonna talk about something different. And as you know, COVID-19 case number decreases these days, and more COVID vaccines are on the way for distribution. Specifically, FDA approved Johnson & Johnson single-dose vaccine recently, and the first dose was administered this week. So it is time for us to plan our events this fall. And today I'm going to talk about the potential flu shot events in Reading. So first, why we need flu shots? Well, according to CDC, flu shot has these following benefits. First, flu vaccine prevents millions of illness and flu-related doctor's visits each year. Flu vaccine has been shown to reduce 40 to 60% of doctor's visits caused by flu. And second, flu vaccination can reduce the risk of flu-associated hospitalization for children, working-age adults, and older adults. Specifically, the admissions of flu-related intensive care units. And third, flu vaccination is an important preventive tool for people with chronic health conditions. For example, heart disease, respiratory disease, especially COPD, and diabetes. And as you know, CDC also says flu vaccination helps protect women during and after pregnancy. Meanwhile, flu vaccine can be life-saving in children. The vaccination can significantly reduce a child's risk of dying from flu. And flu vaccination has also been shown in several studies to reduce severity of illness in people who get vaccinated, but still get sick. For example, flu vaccination reduce death, ICU admissions, ICU length of stay, and overall duration of hospitalization among flu patients. Moreover, getting vaccinated yourself may also protect people around you, including those who are more vulnerable to serious flu illness, like babies and young children, older people, and people with certain chronic health conditions. So, of course, we hope COVID-19 pandemic could end as soon as possible. However, if the pandemic continues this fall, why flu shot is still necessary? Here is the 2020 report from UCSF. Probably could give us some insight about why we still need flu shots during COVID-19 pandemic. I think overwhelming hospitals may not happen again, and we shall not have any problems about COVID testing. But one thing is critical. We do not want both COVID and flu at the same time. So here is our flu shot plan in Reading for the 2021 to 2022 flu season. We plan to order Sanofi flu vaccine, and we want to order 200 high dose for 65 plus, 450 flu block for people aged 50 to 64, and 300 regular flu shots. And I'm gonna show you the 2021 to 2022 Sanofi flu vaccines presentation and the pricing. Okay. So for both high dose and flu block, they are $54.89 per dose. And for the regular flu shot, it is $17.20 per dose. Before I get back to my PowerPoint, do you have any questions? Okay, so I'm gonna come back to my slides. So, you know, we are still in March and we are still in pandemic. So let's mask up and mask up. Thank you very much. Do you have any question?
Oh, that was loud. How many, do you know how many doses we ordered last year?
Yes.
Peter knows, yeah.
Yep. The numbers that she put up, the 200, the 450, and the 3 is exactly what we ordered last year. We spent $39,171.63 last year. That's according to the sales rep.
Yep.
And I figured out, looking at the slide previous to this, that it's gone up almost 5% from last year. So I think those numbers are going to be discussed carefully with Jean, and she will know. That was one of the first things she told me when I got here. I was really impressed with that revolving account. How the heck did you get that kind of dough in there? And it's not a break-even deal, but you know, you get most of your money back. Flu, and it's just now a matter of economics. How much can we afford? I mean, we had some problems last year. I don't know, and it sounds horrible. Even before I say it, it sounds horrible to even me. I'm not sure what we gave out. My understanding that we did around 500 doses last year. What happened to the other 450? I know there was we had an event where some got destroyed because of carelessness, and I'm not sure what we collected from reimbursement. We were in pre-fall from October, November, December, when I was getting here trying to figure out what the heck is going on. And I'd have to go back and start to look with accounting how much we pulled in on the reimbursement that the state does. So we can see what is in that revolving account. And there were just fuses blowing all over the place, and it wasn't due to anybody in town hall. It had to do with this state of emergency, the globe, and everybody going several different directions at the same time. But if we're gonna do a flu season clinics for next year, we're gonna have to do it a lot different than the way it was done this year. I don't care if there's it's still a pandemic going on or not. By then, fire department has plenty of experience. We know prep mod. We had to learn things on the fly all of a sudden. And so this is a big responsibility. I don't want to let it go anymore, Rick. I said I did. I'm reneging on that, but we want to be prepared for it. And how much do we get? This is to Kerry's question. I think there's going to have to be some economic discussions around that, and I'll ask Dean to help me out.
Can I ask about, doesn't the state provide cities and towns with free influenza vaccine?
Children only now. That's it. That was new to
Say that again?
children.
Children only.
Flu vaccine is the only one they get. They give anymore. They used to give out,
Do you know how
kind
many,
of a battle even then, but we used to get
do you know
all.
how many we get, or is it allocated by your population and the number of, how does that?
I wasn't even aware they're only giving out the children's, and this might be the first year. I hope somebody can verify that for me, but I know we were doing flu clinics in Danvers and we were not buying them, but they were limited on how many we gave out. And instead we were promoting the local, we had 6 CVS pharmacies, 4 Walgreens, and why aren't you going there? This is where we had partnerships, public-private partnerships all over the place, in which they would come. We would get the people to come to town hall, and CVS would come and hang a sign in our town hall and do the vaccinating. So we didn't have to worry about purchasing. We found other ways to get vaccines to the folks in the venues they were comfortable in. I can't say I know the same. I don't know the players well in this community where I just began. I was living and working in Danvers for a long time. So I don't know what they're going to give out, Rick. I found out recently that they only give out children's vaccine for influenza.
Yeah, then a budget reduction.
I mean, the philosophical point here, or really the conceptual issue is, 20 years ago, 30 years ago, 50 years, with however long there's been flu vaccine around, there's been a role for boards of health to do these kinds of clinics. And over time, in order to ensure a higher degree of the population would get vaccinated, in addition to whoever got vaccinated in their doctor's office. Over time, and I think the pharmacies are probably the biggest contributor, they've kind of gotten into the act, which is great. And it just many more access points for getting your flu shot. And so the sort of conceptual question is, in 2021, does it make sense for the Board of Health to spend $40,000, distribute nearly 1,000 vaccinations, and then do the administrative work on the back end to recoup, the administration fees from the insurance companies, which is what CVS and Walgreens do, and the cost of the vaccine, and is it in this current year, is it still necessary for boards of health to do, flu clinics? I'm a little torn, frankly. I could see the rationale for not doing it. On the other hand, I think the rationale for doing it is, one is there's an expectation on the part of residents. I think, in particularly for elderly patients, they're very used to getting it at the Pleasant Street Center, and this would be, a change. And elderly people don't deal well with change. I'm sort of getting into that age category. The other piece is that it does keep us sharp. It's kind of like an ongoing training program. And yes, here we are in a pandemic, and the state took it away from us. But that may not always be the case. And there may be other, epidemics where the ability for us to have the skill set in-house to be able to run a clinic for some other epidemic disease. The flu shots actually provide, annual training, essentially, to maintain that skill set. And so, as I'm talking aloud about this, I'm sort of leaning more like we should at least, do what we did last year. I seem to remember one of the clinics we did last year, we did vaccinate like 900 plus people in one sitting. I thought, but I could have the numbers wrong.
I remember that too. It was the Coolidge thing. Was it in 900 total?
No, the Coolidge, I'm gonna say it was 300.
Okay.
Maybe
That's
it
what
was
I remember.
Yeah, I think it was
Why?
300.
It's funny, Rick, because I have the same 900 in my head, and I'm not sure why. And
Yeah.
it's funny that we both have it in our head. So I'm wondering if it was a adding up of
It
all
might-
of
Maybe it was
the
adding the
shots.
Pleasant Street Center plus the
Yeah.
Coolidge and everything.
Yeah.
I think so.
So when Peter and I talked about this earlier this week, I thought we should bring it to the board and see what other people think about, should we, purchase these and continue to do this work or not? And so those are my thoughts on it. Yes, Paula.
So my thought is that to the point of the letter that Carrie wrote, I mean, this is one of our, and to your point, that this is how we've been practicing for things like the pandemic, has been using the flu clinics and helping with that kind of organization. And we may need it again at another time. So I think, and that's for our side of it. For the community side of it, it is a community event, and people look forward to it. I mean, I've worked some of those clinics, and it's like a little fair, they're all happy to see each other, and oh, how you doing, that kind of thing, so it provides that as well. But so God forbid that we have another pandemic like this. I think we need to be prepared.
Yeah. Other thoughts? Kevin? Jerry?
Yeah, so I was just going to say, maybe there's a way to do both, somewhat like what Peter had said. So it's still the health department's role, make sure that there is an in-town clinic, but why do we have to run it? Why do we have to purchase it? I don't know if that makes sense, whether it's CVS or I know at my work, they hire people to come in. So it's my employer that's still taking care of its population, but they're not the one buying the vaccination and billing. You know what I mean? There's an opportunity to do what Peter did, like public-private partnership, where we make sure that, the residents have access to that at the senior center. But does it have to be us buying it?
So we might have our nurses providing the vaccine, and we provide the facility where the vaccine happens. But for instance, CVS might purchase the vaccine and agree to do all the billing subsequently. Is that?
I was just thinking the nurses could attend and make sure it goes off, but they don't have to be involved in the actual vaccinating.
Oh, okay.
I think I like both of the ideas that you just presented. I definitely like Jerry's idea, but I think I would prefer to have the nurses administering it. Again, get back to that training component part of it. It'd be great if we could get the paperwork and the back end part of it off of our plate from a purchasing standpoint, from a chasing those funds back down standpoint, that'd be phenomenal. I think that'd be the best of all worlds if you could do that and still be able to have the nurses get, used as a training resource. And, Rick, to your point earlier, what better time is there to try to stress out a system than when it's under the most stress, right? So there's no better training than when you're in the most stressful environment. That's when you can really figure out, what your tolerance level is, so to speak, as a department. So I think that, the pandemic to me seems like a better opportunity to conduct something like that, not a reason not to do it. I think you learn a lot more from those kind of situations. So I definitely in favor of it. I know 2 particular assisted living facilities in town that we go there and we do them right there on the spot. And I think that would be a huge change to not do that for those groups of folks that are at high risk. So my preference is to still do it, but I love anytime we can do a public-private partnership, and especially to remove any kind of upfront costs and billing, I think that'd be tremendous. I don't know if that's something that's even doable right now for next year, Peter. It sounds like ordering is imminent, but maybe for the year after, if you can't get it started for this year.
If I could just jump in, the budget was discussed last night at the Finance Committee, and a question was raised about staffing levels, and specifically in public health, and questioning, one of the discussion points was to question, will we need all this staff post-pandemic? And so I would urge the board to think about benchmarks that we can include going forward, like flu clinic numbers, so that we can say and justify and have some rationale for why we need the level of nursing that we have. Nursing has never been as high as it is now, and we need every bit of it. So I would hate to think that, okay, on the one hand, I agree, combining with partners and doing things is very good, but when I think about preserving staffing levels and having this activity sit with public health, I feel like it's something that would support what we're trying to do with the staffing levels.
Are you suggesting to not get into some kind of public-private relationship then, Gene, under that, guys? Because I don't see that as being a staffing level issue. That's just a paperwork issue. I don't think the nurses aren't the ones doing the follow-up on that, correct?
Right. If the
Or
nurses
chasing down the funds.
If the nurses were dispensing the vaccine, that justifies, I mean, for Jerry's point, to like offset the purchase and the recovery of costs, that's sort of a business component of it. Really, the benchmark would be, we gave out 1,000 vaccines. It doesn't matter who bought them, who recovered the costs or whatever. And I could also see like a CVS or Walgreens potentially, if we allowed them to have a little brand exposure at these events, that might be enough of an incentive for them to
Sure.
to want to do this.
So,
Rob,
and I
that
think
way-
just to answer that question a little bit, Gene, too, that was asked, and it's a fair question, FinCom. I'm assuming it was from a FinCom member who asked the question, correct? Yeah. So I mean, that's their job. I'm glad they're asking that question. Their job is to ask, do we need this? My simple answer would be, I don't know, go back 5 years from a year ago, and then ask the question. And if we're looking back on it, the answer is absolutely we needed it. Matter of fact, we were scrambling for the past year, and in some instances, quite frankly, got lucky that we had just such a high quality of staff on board right now. But 5 years ago, if they had asked that question, you might say, oh no, we'd be fine. Well, we're never living in that we'll be fine world again. I mean, this is now on the ready, need to be on the ready from now from now on, this probably won't be the last thing that comes across. That's going to be some kind of, I won't say pandemic, but some kind of major event, right? So I think that's the important piece to keep in mind with this. But certainly it's a fair question for them to ask.
Carrie, yeah, Carrie.
So, three things. So, emergency dispensing site planning and operation is not going away. It's still a deliverable for the Office of Preparedness and Emergency Management money. We need to have a plan. We're supposed to submit it, have it reviewed twice a year. And we're supposed to be able to demonstrate that we can actually do it. So to that end, I very much support if we've got to do it, we might as well be doing it and providing a community benefit at the same time. As for finding a way to deal with the administrative aspects, I support that very much. I'm going to come hard on the community benefit piece as well, though. I think at least for the elder services aspect, that kind of thing, I think that has some value. And I think that we need to think about public health as what is the community benefit besides the invisible aspects of providing safe dining and inspecting housing and things like that. There is a value to that. There's a value to our contribution to the community. And why do we care about public health? It's one of the few things that makes us visible on a larger scale. So from that's my perspective. I think that it has value to the community, and it also is important to the department. And then, like I said, I mean, EDS isn't going away, so we might as well have our nurses do their thing and make sure that plan works. And it can continue to be a partnership with fire. Assistant Chief Jackson is a fabulous incident commander for the clinics, and I mean, we can certainly continue to do that.
But that's a good point. That not only is it a value to the community, but it does, having these types of clinics, flu shot clinics, do heighten awareness in the community about the importance of getting flu shots. It shows that we're doing something, that we're concerned about it.
Yeah.
Yes, Jerry.
I just want to make sure that everyone's clear that I wasn't saying we shouldn't do this.
Right.
I think
yeah.
Oh, no.
responsibility is to do it. It's just how do we do it? Okay.
No, that was very clear.
Understood. So I think the message, Peter, is that we should do this, but I don't know why there's so much time pressure to buy 1,000 flu shots, 6 months before. But is that something you could do, or Jean could do in the next couple weeks? Is connect with, maybe, I'm sure big companies like Walgreens and CVS have community relations people, who you could explore this idea and see if there's excitement or interest in collaborating with us on that. It's the kind of thing where if they are, and you feel like there's some serious opportunity to offload acquisition and billing in return for a little bit of publicity and community goodwill, that would be great. But I think if that doesn't, you don't get a lot of interest in the next week or 10 days exploring at least those two companies, then we should just go ahead and purchase and then figure out how we're going to be better at recouping the costs. But in either case, I think we're talking about, we'd like our nurses to be providing the vaccinations. Sounds like a plan?
Sure.
Okay.
I
Great.
saw the word procurement.
Yeah, I just read that too.
Is that procurement, Jean, for the shot acquisition?
No, if we were to, I think I think the shots are on the state bid list.
Yep.
But if we were to, and I like the idea of reaching out to our community partners, CVS, Walgreens, whatever, we'd have to make sure we're on the right side of the procurement process.
Okay.
For making sure we're following all the right legal requirements, and
Right.
if we're gonna invite interest, maybe there's a process we need to follow so that good old Allison will keep us on the right side of things.
Yes.
And I don't want to complicate things, and I think we should just go with that plan. But the other thought would be, you know, Winchester Hospital or Melrose Wakefield Hospital. Hospitals have a lot of resources, and they know how to do billing really well. And so those would be another. But I think
Yeah.
I think the community pharmacies make sense.
And I know it's a little, the timing doesn't match up, but this would be a pretty good shared services kind of discussion, because
know.
we are not the only
same
community dealing with this. So it would be, you know, what could we do as a collaboration to take manage the burden somehow. Next time.
I know.
Make a note and add it to the list.
Okay, so I have, in terms of our last agenda items, thinking about March 18th. So I was going to raise with the board the idea of potentially not having a meeting on March 18th, only because it seemed like, at least for now, that there weren't any major items coming down the pike. The health director position needs to be posted. We've kind of put off that internal assessment for now. And it could be that Peter just provides us a report, updating us in a couple of weeks. However, there are potentially two things that have come out of the discussion tonight that might warrant having a meeting. One is, you know, if the discussions around doing this grant come up with some sort of concrete proposals, it would be an opportunity to run it by the board in 2 weeks, and that would still be within the short 1 month time frame, you know, to get something up and running. And the other piece would be any follow-up on this influenza public-private partnership idea. If there's been a couple conversations with, let's say, Walgreens and CVS, we could follow up on that. You know, I'd probably, based on that, it probably makes sense to have a meeting. It could be a shorter one, but what do people think?
I
Makes
would favor
sense?
that.
Okay. All right. Anything else?
Jean has
Yes, Jean.
Bob wanted me to make sure I mentioned that he is working with the select board to hopefully within the next few meetings get the classification chart updated with the health director position. So I don't want to say a date because things change, but it's a priority, and Bob's working to get that on a future select board agenda soon.
Yeah.
Good.
Unfortunately, there's a lot on the March 23rd agenda already, and then they don't meet again till April 20th because of town meeting. So anyway, that's the calendar working against us, but we're working to see if we can come up with a way to make that happen.
I mean, I get a sense there's a lot of support on the select board for a health director position.
yeah.
And particularly now with us not having a health agent, it's sort of in crisis mode. So I think hopefully they get that sense of urgency.
Yeah, and I think this would just be one one thing that they're looking to make this addition to the existing chart. It has to go through a public hearing. So that's,
Got
of
it.
course, in government, everything we do is complicated and there's
Yep.
all rules. Kevin, yep.
Yep.
As it should be.
I don't make the rules. I just try to stay on the right side of them.
Yep.
But so that's where
Oh,
it
I
gets,
don't know about that, Peter.
so
mean,
My
I
favorite
think
question, my favorite question to town council used to be, what if we don't do that? What's the penalty? He loved that question out of me.
Oh,
He would cringe
man.
every time I asked that. I was just always curious, what's the penalty? That's worth it.
You never know
Active
what side of the bed the
policy.
judge is gonna get up on.
Well, the other thing about this is that I think, Peter, you had mentioned to me about the, I don't know, is it the MHOA, the Mass Health Officers Association?
Yeah.
They have a listing of like jobs of, open positions available. And there's like 8 health agent, health director positions available. And, and the qualified individuals are as rare as hen teeth. And so I'm a little concerned about that, but there's nothing we can do about it.
So
Reading will be in a unique position to recruit because of this setup. It's really gonna be exciting to anybody who wants to break into public health to have it under this structure. And the reason I said it should
Right.
take some time and some thought, because, and the best way I can describe it is if the police and fire chief, the full bird colonels, and the health director in the same department as a lieutenant colonel, you're at the table and that's fine, but you're not gonna get the same respect or people's ears. So you want to be cautious about that stuff. That's gonna be the real tricky piece, I think.
So I watched the last meeting back that I missed just to get caught up on it, and I thought Bob said specifically you can still start the process. It's just he can't technically hire anybody until it is listed in that.
Yeah, actually, he did say
Does everybody
something.
remember that?
Yeah.
yeah,
So
we
the question is whether you can post and begin the recruitment process and get candidates who are interested, but not be able to hire until that. Is that?
In my understanding from if I'm wrong, we'll find out quickly. But that's pretty much what Bob says. That it doesn't stop us from beginning the process. It only prevents him from doing the actual hiring. So, you could theoretically have the next person on the hook ready to go, waiting for the select board to go ahead and list it and then sign the paperwork the next day to hire. Theoretically, it's not going to go that way, obviously, but even in the light of what you just said, Rick, the fact that there are other jobs out there, and if we do have a leg up, I would like to leverage that position right now, or get us listed as well. So but look at Reading over here; they're offering something kind of unique. So rather than lose out candidates to those other positions that are available, to me that seems like even more urgency to get going.
Well, I'm happy to follow up with Bob to get some clarification on that.
Okay.
Yeah, hopefully the select board will take it up soon. And then that will really kind of make the path a lot cleaner and easier. Select board adopts it under the classification plan, and then we post it, and then we, do all of our shaking of trees to find the best candidate, and we're up and running.
Okay. And also, while we're on that, just to bring that up, I really did like the idea from the committee standpoint of having somebody on the committee now and then a previous member of the committee. I don't think we're going to get away with associate and full member because the open meeting law doesn't define associates in any way. It says members of the board. So I think that's going to come back as a no-go from Bob. But certainly, I couldn't think of 2 more qualified folks than the last two chairs previous that are no longer on the committee to sit in. And both Emmy and I got to forget my other colleague's name.
Eleanor.
Eleanor, thank you. Sorry, Eleanor. Too many names. I think, you know, that'd be something that they would probably be very interested in. And I think they'd be great people to have on that search committee. So just my 2 cents from what you all talked about the last time.
And just on that note, I think we had decided at that last meeting that that kind of feedback should go directly to Bob so that he can factor it into how he sets up the hiring recruitment process. So if you haven't sent an email, you should send him an email.
I'll send it off right now.
All right, I think we are done. And unlike the select board, on time. Okay, motion to adjourn.
So moved.
Second,
Second.
roll call, Paula,
Yes.
Carrie,
Yes,
Rick, yes. All right.
thank
Hi,
you.
Buenas
everybody.
noches.
Thank you all. Appreciate it.
Excellent meeting, folks. Thank you.
Good night.
Good
See you
night.
soon.
Bye.
Thank